Right, excellent. Hello and welcome. This is our final session of our Diabetes Continuum of Care Learning Collaborative. We've been focusing on improving emergency preparedness for diabetes management. Thank you so much for joining us today. I see that Nancy already went ahead and introduced herself, which is excellent. Thank you so much, Rodolfo and Sandra. Oh, following Nancy's lead. Thank you. Thank you. Love to see the introductions in the chat. I'm going to be asking some questions around your own role in this work. So it's great to start getting to know folks once again, or get reminded of what folks are doing and where they're coming from. So we can go ahead to the next slide. Thank you, Daisy, for introducing yourself. So we're very familiar with the Zoom controls by now. I will just say, obviously, lines are muted to prevent background noise, but love to hear from you. I have a lot of resources I have linked today, but I really want to hear what your thoughts are on how relevant they are, how usable they are. So please feel free to unmute yourselves. Let me know what you're thinking, share thoughts and resources with your peers. Would love to hear from you. Chat box is there is a great option as well. Go to the next slide. And if I believe everyone who's here right now has been with us through this series, but if anyone's watching the recording and is unfamiliar, you can go to chcdiabetes.org and learn more information generally around our Special and Vulnerable Populations Diabetes Task Force. We're going to be rebranding a little bit in the next year as we are hopefully all receiving the next round of funding from HRSA. But these are all the folks that are putting together quite a few simultaneous learning collaboratives right now on different topics. And you can see lots of materials and recordings on that website. Go to the next slide. And as always for this series, these are our three national training and technical assistance provider organizations, NCHPH, National Center for Health and Public Housing, MHP Salud, and the National Center for Equitable Care for Elders. So I'm Ariel. I am joined by Hansel and Dr. Leon, as well as our other colleagues, Chantel from NCHPH and Juliet from NCECE. We have loved putting together the content for this learning collaborative with you, and we have our contact information at the end of the presentation. So we do hope that you'll stay in touch. You can see from the names of our organizations, we have some different focus areas, but we all have a shared interest in diabetes control and have tried to give some unique perspective around the topic of emergency preparedness. So we're looking forward to continuing that on in this fourth and final session today. We can go to the next slide. All right, great. So yes, as you can see, today's the last session. I have on the next slide, Chantel, we have just kind of like a quick overview for each session. And thank you, Juliet. Yeah, we can go to the next slide. Thank you, Juliet, for putting the Google site, because yes, that has all of the slides and recordings and some other external resource links, I believe, for each of these sessions. You can see that in case you weren't able to make it to one of the sessions, the first session we did intros, and again, thinking about unique patient barriers, thinking about each of our priority populations and how they may face additional barriers to effective diabetes management anyway, but how do emergencies, whether that's natural disasters or public health emergencies, exacerbate those, and what unique strengths, resources they may have. So we did some level setting. We then moved to talking really more on the medical side of health risks for people with diabetes during emergencies, thinking about complications and what can be done to both address and hopefully prevent some of those. We then moved to thinking about patient engagement. We talked about specifically the role of community health workers in how they're doing outreach before, during, and after an emergency. And like I said, for today, we're hoping to review resources and reflect on how we're moving forward in this work. Again, there's so much information out there, and I hope that we're going to provide some special considerations today that will be beneficial. But how does that translate into us changing the way we work in this topic? Is it something where we say, okay, well, I'm not really going to do anything differently? Does that mean that you already knew all of this? Or does that mean that you actually would need more support in order to make a change? We want to kind of explore that so everyone feels confident they can move forward and assist their patients in being more prepared for emergencies, especially when they're living with and managing a chronic condition like diabetes. So we can go ahead to the next slide. All right, yeah, we'll breeze through this. This is this part of the learning objectives for the series, hoping to think about some best practices on personalized care during emergencies. We can go to the next slide. All right, we have a quick poll question. Juliet can put that up for folks. I know a lot of you already put your official role with your organization, but in thinking about emergency preparedness, where does your work intersect? What do you do in emergency preparedness for priority patient populations? I've come up with these categories. You may say, oh, there's a different box that I'd like to check. If you want to say other and put it in the chat, that's fantastic too. So the options that came to mind were, do you speak, plan with patients? Are you thinking at an organizational level what they need to do for emergency preparedness? Are you training others? Do you not have a role currently? Or do you do something else? I would love to know if that's the case. So I see a few folks respond. Would love to hear from everyone. I do think that will impact how we oh, great. All right, excellent. So most folks are saying that they're speaking with or planning with patients, which is excellent. I am going to really hope that you can give us some insight on some of the resources that we're going to go through and give us a sense of, have you used these with them? Are they effective? Kind of what are your thoughts there? And then someone's involved in emergency preparedness on an organizational level, which is also so important. So thank you so much for sharing. We can go to the next slide. All right, so this resource from the American Diabetes Association, it's pretty straightforward, but I did want to offer it more of just like making sure we're on the same page, especially when this has been the overall topic for this series, caring for folks with diabetes in emergency situations. So when we're thinking about preparedness, we're wanting to be covering these topics ahead of time so patients may know what to expect. Of course, some of this guidance, again, pretty straightforward, but wanting to make sure that those assisting you in an emergency understand that you have diabetes, needing to be aware, being able to communicate what you need to manage it, medications, testing supplies, making sure patients feel confident in that information, understanding that the Americans with Disabilities Act includes rights to reasonable accommodation. So folks should not be turned away from shelters because they have a diabetes service animal or require the use of sharps, things for that reason. So the American Diabetes Association does have a hotline that you can call. So if that comes up in conversation, that could be a good piece of information. Many of you are diabetes educators already, so I will not go into great detail about why it's so important to get enough fluids. We know that that is so relevant. Dehydration is such a risk for many of our priority patient populations, especially older adults. But we know that if we have a shortage of medication and our blood glucose levels rise, dehydration becomes an even greater risk. So we're wanting to get as much water, sugar-free drinks in as possible. And then being aware that if our blood sugar is too low, too much insulin, and you can see dealing with lack of food, that's going to be a factor. We want to make sure we also are having some kind of candy on hand, something fruit juice, hard candy to treat hypoglycemia or low blood sugar if it occurs. So we're really wanting to keep away from those extremes, of course. Like I mentioned, lack of food. that's potentially a risk during an emergency. And that, of course, is going to impact the amount of medications that you need. There's a lot of complicated factors that might be going through a patient's mind. So things that you can help talk through in a preparedness way, because we know that when we're stressed, when we're overwhelmed, we are not always thinking at our best. So how can we kind of go through a potential emergency scenario and ensure that a patient would be able to be thinking of these factors if they find themselves in an emergency and needing to seek assistance. Of course, watching out for infection is critical. We do know that folks living with diabetes are at higher risk for infections of the feet, especially if there's contaminated water, if their feet are injured. So lots of important considerations to walk through. So again, American Diabetes Association, I believe many of you probably are very well versed in these particular considerations, though I'd be really curious how they come up in those preparedness conversations. We can go to the next slide. All right, so this is from the Diabetes Disaster Response Coalition. Really great resource. There is a large checklist for patients to create their own diabetes kit. As you can see on the slide, the guidance is for all the items. We're going to go through quite a few, but all the items to be stored in a container that's both easily carried and hopefully waterproof, depending on the type of disaster we're trying to plan for. It's probably good just in case for it to be waterproof. A lot of uncertainty. So we're going to go through each of these broad categories in the slides. I'd love for everyone to consider how feasible these are for the patients that you work with, especially since most of you are directly working and speaking with patients. So would love to get a better understanding from you in your conversations. Is this something that a patient can easily put together? How much assistance they may need? All of that. So we're going to start first with the category of important information. We can go to the next slide. All right, so we had mentioned this in the American Diabetes Association list, but information, your own health information in a normal conversation that's not stressful. Probably most of us can rattle off, our any type of medical condition we may have, the medications we need. But it is going to be so important for this to all be written down and updated frequently and easily accessible, because again, stress, uncertainty, it's really important, especially for all the diabetes complications that can happen, that we have this information readily available. Is there anything else that you don't see on this list? I won't go through we can see how, medication, supplies, our doctor's information, family information, copies of IDs, all important. Is there anything missing when it comes to information? We're going to talk about actual physical supplies in a minute, but anything that's missing here, in your opinion, information-wise? It's not a trick question. I'm telling you, if you think this is good, that's great. Is there anyone who has any other suggestions for information? Feel free to think on that. Get it all laminated. Yeah, for sure. I do wonder what folks think. Even those what do you call them? Inserts for like binders that you could easily pull in and out, still maybe some water could leak or something, but it would be more protected and you could still swap it out easily if something changes. Yeah, important too. Obviously getting it in a waterproof container is good, but it may not be 100% protected, and a lot of things could happen to that. Awesome. All right, let's go to the next slide. All right, so on actual diabetes supplies, of course, it's important for folks that are managing an illness that requires a lot of supplies to make sure we have enough to get us through an emergency. Again, many of you are diabetes educators, so I would love your opinion on this list. Certainly some of the rules that we have around diabetes supplies in everyday life kind of change in an emergency a little bit when it comes to the usage of medications. So if we lose power and have unused insulin, normally we would throw it out. But in an emergency, we're saying don't throw it out. It's okay to use expired or non-refrigerated insulin in an emergency, but not frozen. So we want to kind of differentiate, where it might be okay to bend some of the rules, where it might not be. Certainly the longer that insulin is exposed to extreme temperatures, the less effective it becomes. So these are, again, no dry ice, because again, we don't want to freeze it. Batteries, we're going to talk a little bit about this in a little while, but not everyone's going to be able to plug something in. So having batteries is going to be way more effective than things that need to be plugged in. Anything else that folks would add for diabetes supplies specifically? Is this all tracking for our diabetes educators in the room? Is there anything that's more difficult for your patients when you've had conversations with them? Jose, did you have thoughts?
Yes, you've been talking about wound care. So over-the-counter ointment, just to prevent any infection, any skin infection, would be nice.
Yeah, that's great. Anything else folks can think of before we go to the next slide? We have some other general supplies on the next slide. Chantel, we can go ahead. All right, so again, we're thinking in the context of diabetes emergency preparedness, but of course, that's not the only thing that someone's going to be thinking about in an emergency. So these are kind of the standard other supplies. I see we have first aid here too, so that speaks to what Dr. Leon was saying, but certainly, especially with diabetes, the concern for wound care is so relevant. Certainly food, water, thinking about extras of everything, but again, what's going to fit in that container, in that backpack, it's going to be a balance, right? Anything else folks would add here? This is, again, the other general supplies, if you're involved in emergency preparedness work in general, a little bit more. Are there things that are missing here? I'm going to take no response as like a thumbs up, which is great if this feels like a thorough checklist. Again, would still love feedback on if there's anything in particular that patients kind of struggle with in regards to getting it prepped, and if they feel confident doing that on their own, or if they need assistance from the health center or organization that you're coming from. We can go to the next slide, Chantal. I think we have one more slide for this checklist. Other recommendations. So this is a little bit more of like a catch-all category. Certainly preventive care in general is so important, especially for folks managing chronic conditions. So this is less of something to bring with you and some more of like something to do before an emergency, is trying to make sure that we're up to date with all of our needed vaccinations. We don't want to end up with additional health complications because we weren't on top of those preventative services. So just kind of a note of encouragement for folks. If it applies, a meeting place may be relevant. We are going to talk about social networks, and this may not be a relevant point for some folks. They may not have a family or connections to meet up with, but if that is the case, it's important to know what they might do if they get separated. If folks do have a physical medical ID, certainly that's relevant. Chantel from NCHPH gave us a really great link in preparation for this session around setting up a medical ID on your phone if someone uses an iPhone or an Android phone. So there's a link in the slide. Juliet may be able to put it in the chat as well. But I thought that was fascinating. Certainly with technological literacy or access, it might not be a relevant option for everyone, but how great is that for folks that it is relevant for, that might be able to make sure information is readily accessible, even if they don't have a physical ID on their wrist or around their neck. All right, so I've asked this question at the bottom of the slide in each slide. So I'm going to take a guess that no one has anything to add, but I want to ask it one more time. This again, each of these slides has been on a much larger checklist that you can print out. If you don't already use something like this, you could print it out and have folks check things off as they prepare them. Certainly once it's packed up, it may need to be updated. So we want to make sure this is not truly like you made a kit a year ago, 2 years ago. You may want to have some kind of a system to make sure that information is up to date, especially, but supplies are up to date as well. And that folks have what they need. So I'm not seeing any chat messages, so we'll go on because there's lots of other content for us to get through. So let's go to the next slide.
Yeah, I'm not sure if
Oh,
I
yeah.
missed it, but I didn't see a glucometer. I mean, if all, if not all, patients with diabetes have one. And these are very.
Yeah, I think it was a catch-all bullet point in the last.
Okay, got it.
Yeah, I totally get it because it might depend on, each individual exactly which diabetes testing supplies they have. But yeah, I think there was a catch-all.
Okay,
But
got
yeah,
it.
it's good. No, I think Jose, it's a good point as far as when you're talking through a list with someone, you may need to then say, okay, so which diabetes testing supplies do you use right now? Like, how do you use them? You might want to do more exploring versus just having them say, okay, get your diabetes testing supplies together for an emergency kit. So yeah, it's a great point. All right, let's go to the next slide. Great. This is an article that's a little older as far as it doesn't have some emergencies from the past few years, but I still think is a really great reflection from Johns Hopkins around lessons that we've learned around emergency preparedness and diabetes. So I put some takeaway points from this guide of things we learned from Hurricane Katrina in this on this topic, and then considering the needs after another hurricane. So some of the needs that were identified for patients were, of course, we've been talking about accessibility of medications, how much are available for folks, personal preparedness and self-awareness that we're going to keep talking about through today, accessing medical information, and then how organizations are communicating with each other. We don't have enough time, certainly in this series, to dive really deeply into community partnerships and how crucial they can be in assisting patients during emergencies, but certainly communication is so crucial and it often breaks down in emergencies. So that was definitely a lesson that was learned during Hurricane Katrina. And then during a needs assessment that was done right after Hurricane Charlie, we saw that older adults disproportionately experience disruptions in routine medical care. Obviously that natural disasters that's going to happen. It happened with public health emergencies as well, COVID-19. But if folks are not able to have that routine care, often that's going to lead to worsening symptoms of their existing conditions and could leave them greater at risk for others. Of course, access to prescriptions. And then this is a really interesting note. I don't think many of us in this room are going to be involved in that needs assessment work right after an emergency. But this needs assessment was done almost 2 weeks after the hurricane, when really I think people were asking, reflecting, hey, people should have been checked on earlier. There should have been more analysis of immediate need. So it kind of speaks to the need for staffing, for the foresight to say, okay, if an emergency happens, who is stepping into that role? Who is then, connecting with people in the community and assessing what are the needs right now? Not just what are the needs that we talked about might occur, but what's happening right now and then acting on it. So really interesting guide. We'll go to the next slide, and there's some general roles, I believe. public health objectives. Again, if many of you in the room right now are diabetes educators, some others who work at an organizational level, they might find a few more of these objectives relevant to their roles. Again, needs assessments are so important and may not be something that we focus on a ton today, but again, want to speak to the value of it. Other objectives are doing that work of understanding what's available as far as resources and making sure that the needs that are identified are met. So even if we understand a need, we need to make sure we we also understand what's available for that individual or for that community, and that takes really active effort. We of course want to prevent additional adverse health effects from happening. So that's really, that's a ton of work beforehand, obviously on an individual patient level, as well as a community level. Thinking about disease control strategies came up a lot in conversations, obviously for things like COVID-19. And then there may be folks who are thinking about evaluation and then improving upon planning for future disasters. It is going to be part of these cycles for us over and over and over again, especially for natural disasters. As we know, it's a seasonal experience where we're in a season of hurricanes, tornadoes, we're dealing with the immediate impact, and then we're reflecting on what worked, what didn't, what are we doing in the future. So just kind of want to the what role will you play is a little more reflective than a direct ask for you, but just thinking about how each of our work intersects with these different objectives, and hopefully how, we can't prevent, obviously, emergencies from happening at all, but we really can make a difference in anticipating those needs and trying to improve upon the way we address those needs when they happen. So we can go to the next slide. All right, so health literacy. Hansel touched on this last week, especially in talking about that one-to-one communication that CHWs or community health workers were doing with patients. But I wanted to spend a little more time on that because I think it's such a crucial topic. That we have so many resources out there. We just went through a few about, hey, you should do this, that, and the other thing for emergency preparedness if you have diabetes. That's great that those checklists exist. That's great that we have this knowledge, right? That folks with diabetes are at risk for this. They need these supplies. But how do the patients understand that information? So health literacy as a concept, I think most of us are familiar with this, but it's really isn't. It's a good health literacy practice to make sure I'm actually clearly explaining what that is. So health literacy is about the way we take in information, the way we process it, understand it, and then act on it when it comes to our health. So that can be at a personal level or at an organizational level. So both of those things are very relevant here. But we're primarily going to focus on individual health literacy for patients around the information that we are providing to them. So we are the active communicators here, and how are they understanding and internalizing and then hopefully acting on the information. We know from this CDC article that health literacy impacts how we plan for an emergency. If we're staying up to date, we talked about preventive care, vaccinations. It helps us to manage a chronic condition, and it will help us to avoid post-disaster hazards. And health literacy is something that is not stagnant. It changes over time. We can build it as a skill. And like I alluded to when we were talking about the checklist, there are some things I think all of us can relate to. When we're feeling our best, we can remember lots of things. Before I had my son who just turned 1, I feel like I could remember so many terms. I could remember, I felt really like on my game. And I've had some days at work where I haven't slept much because my baby has not slept much, and I can no longer easily remember as many pieces of information. And that's not even an emergency. That's just a little bit extra stress on my body and my mind. So the point there is that in an emergency where things are not as we expect and things are really stressful, we may not be able to easily access information, process it, and take action. So we need to make sure that we are explaining things as clearly and consistently as possible to really enable patients to be able to utilize the really vital information that we're sharing. We'll go to the next slide. All right, so what is our role in promoting health literacy and increasing it for emergency preparedness purposes, or just really in general, because health literacy is not just in an emergency, it's not just at a doctor's visit, it's every day, because we're doing things for our health every day that either maintain it, improve it, worsen it. So there's a relevance, all day. Everyone plays a part. We can build our own skills, lots of learning opportunities out there. We won't go into great detail, but we can work on our own communication skills. Creating messages with trusted leaders. Hansel talked a little bit about this last week. So critical if we understand the patient population that we're working with those trusted leaders to develop materials that are going to speak to those unique needs, cultural backgrounds, understandings of, healthcare, understandings of emergencies. That's going to be incredibly beneficial. Translations, really important that it's not just we put it in Google Translate, making sure that translations are really culturally competent. We're wanting to make sure that language preferences, cultural references are really reflected in translated materials. That could be a role for those trusted leaders as well to review. Plain language is so important, and I know that it's talked about quite a bit when we're talking about health literacy. But if we think about the COVID-19 pandemic, we first started to hear a lot of public health messaging. When we first started to really understand, it was less about COVID-19 living on surfaces and more about breathing in each other's, breathing in the molecules that were considered in the air. We talked a lot about social distancing. For some of us in public health, or other professions, that might have been really straightforward. Like, okay, yeah, I get, like, I'm going to socially distance from my neighbor or my colleague, but that confused a lot of people. That didn't actually give concrete information for what to do. It was kind of a more confusing concept for many people. So the CDC then responded in a very plain language approach to say, stay 6 feet away from others. We started to see more things on the floor in stores of like, stay 6 feet apart. Some people had fun ways of articulating what 6 feet was. I saw a couple signs about how many dogs it was apart, but using concrete terms was really helpful. And plain language does not mean dumbing something down. I really want to be clear about that. We don't need to talk to people like they're a child, but we do need to be aware of reading levels, of first languages, of lots of other things. Again, stress, of emergencies. We want things to be incredibly clear, and it's so much more valuable if we can take a universal precaution approach of saying, why go to the effort of trying to say, well, oh no, just this population needs something in plain language. These other people can definitely have this other kind of terminology. Why not just have plain language, easy, simple across the board, and it reaches the largest number of people with hopefully the least amount of resistance. So that is the goal. And of course, we're trying to build skills over time. So hopefully if we're having these conversations, helping folks to learn new concepts, they can then carry that with them as they take in new information about their health, about an emergency, about something that they didn't before know about, and hopefully they'll be able to process that. And of course, ask questions, especially if you're an educator and they've built that relationship with you. So these are all different roles we may take. Would love to hear from you if you have something else you would add here for health literacy, but hopefully that makes sense. We have a graphic on the next slide. Chantel, yes, that's more general around things to consider when we're communicating about health. I personally love talking about health behavior, so you probably have gotten that by now and seeing some of these slides, but this CDC graphic, I think, does a really great job when we're thinking about this in general. The article that it links to talks about some I believe some outbreaks that are a little bit more dated, but it has some great understandings about how health behaviors are rooted in social norms, in personal beliefs, in traditions. They all impact in individual preparedness and response to emergencies. So we're wanting to communicate and design campaigns that change behavior, but are also culturally and socially acceptable. So we want to maintain that cultural humility. We want to understand why people think the way they think, why they do what they do, not just assume that we understand human behavior because we come from one corner of the country, one corner of the world. Like being open-minded, being willing to keep learning ourselves about how people understand the world around them is hopefully going to make the way we speak to them about their health as relevant to them as possible. So we're wanting to build trust. I know these questions are very small on the slide, but I do like these questions. I normally don't like to read from the slides, but reflection points. Again, you may not be involved in creating materials, or you are, that's great. But if you're just having these conversations, which it sounds like a lot of you are, will people trust the information? You know, if you have an ongoing relationship and you're the one providing it, maybe they will, maybe that's not a problem, but that's because of all of the effort that you are putting in to checking in on that individual, but making sure that we're not just kind of passing along information and saying, hey, you should definitely trust this organization, and assume that everyone is going to react the same way. You know, information wise, there can be so much, sometimes there's too much. So reflecting on what's necessary, how people are finding it, how much is enough, too much. Again, we could make this PowerPoint presentation hours long, but is that too much for you? Yes, probably. So is it better that we send you home with links for further reading if you are interested when you have time? Yes. So thinking about that balance too, when we're passing along information to others. And how relevant motivation, I could talk for a very long time about patient motivation, but we're really wanting in these conversations with patients to make that really relevant to their goals. So if we're saying, okay, it's really important for us to make sure you're able to put a diabetes preparedness kit together. Maybe it's not enough motivation to say, hey, like you don't want to be without medication, but you want to say, hey, you want to stay healthy because you know, in a couple months, your grandson is going to graduate from high school and you want to, maintain your health, see him be, up out of your chair, whatever it is. Like, there's ways we can connect on an individual level to push through that motivation. And again, acknowledging that our motivation may be different than a patient's, but finding that and hopefully moving towards behavior change. Certainly, we've talked a lot, I think, about the environment conditions that affect the patients that we work with. So absolutely being aware of that in everything we're communicating, not pretending like there aren't a lot of other factors going on. And again, in an emergency, going to be so many unpredictable factors. So we're really trying to equip patients with the motivation and the confidence to move through that uncertainty when those same supports might not be in place. Capacity, that I think ties into some health literacy concerns, but are there barriers to acting on information? What other support is needed? Is this someone who really might need additional supports during an emergency? And what services are available in your community to assist them? perception and response. This is all leading to how folks are going to take action, or hopefully they will take action. But how will folks respond after all of those conversations, after every checklist, every check-in? What is going to happen in an emergency? How are they going to respond? You are not the only person who's responsible for that, but you do play a part. You do play a part in helping them to understand, helping to give them an opportunity to work through some questions or uncertainty, and make sure that they have resources at their disposal when, again, the unpredictable may happen. So I like this considerations. A lot of these are related to each other, so it's not something we need to necessarily think about each step as we're talking with patients, but I hope this, especially for those who are working one-to-one with patients, I hope this gives some food for thought, and you can kind of see where your efforts are aligning. And I think that some of the work of the CHWs, enabling services staff, that Hansel talked through some of the different goals, you can see how they really can work with patients in a lot of these areas, which is great. All right. Yes, was there any, I know there was like so much from me and not a lot of group thoughts. Again, I'm going to hope that that's because it aligns with what you all have seen, but I would happy to have questions, comments, pushback, other thoughts before we move on. I just want to give folks a chance. Because we do have a little bit more to talk about, and this is going to be a little bit more a little bit less on specific emergency preparedness supplies. We've kind of already talked about in this session, hey, what do folks need? How should we communicate the information? But when we think about the actual response, so the graphic on the previous slide, ultimately it's response from the patients that this communication leads to. What happens when someone doesn't have the support they need in their own personal lives? Thinking about the importance of social connection, thinking about community resilience, this idea that a group of people in a community can endure a really difficult, uncertain time. Again, whether that's natural disasters, public health emergencies, man-made disasters, and then be able to respond and to heal and to recover, move forward. A lot of that has to do with how we interact with, support one another, and we understand that disconnection leads to adverse health effects. And we think about in the context of an emergency, how much more of a threat that disconnectedness is for a lot of these priority patient populations that we've talked about. Social isolation and loneliness, just as an aside, I'm coming from a center that focuses on older adults, and this has been a topic of concern for years, not just because of the COVID-19 pandemic, but it was exacerbated during the pandemic. But we think about, what about folks who've been isolated during an emergency? Again, we talked about having a plan to meet up with your family if you were disconnected with them during an emergency. But what if someone doesn't have, someone in their circle? It's something for us to, understand what someone's social network looks like, and then hopefully be able to identify gaps and address them prior to something worse happening for them and their health. So we're going to talk about a way to do that, a tool if you are working with patients one-to-one, to potentially understand their social network and then be able to offer resources. Again, we're all coming from different environments. You may have a lot of community resources at your disposal. You may not. There may not be as many services or supports available in your community, but we can only do as much with what we know. So if you are working one-to-one with patients, social mapping, care mapping might be able to be a good approach. So I want to take a few slides to talk about that. We can go to the next slide. So care maps are ways that we can help, that healthcare staff, other community service staff can have successful collaborations with care partners and identify unmet care needs. So this is something that is not emergency preparedness specific, but it can be utilized for a lot of different concerns. Thanks, Juliet. There's a great document from the Atlas of Caregiving that is linked on the slide and also in the chat. Again, it's not emergency preparedness specifically focused, but again, it can be used in that setting. So you can see a very basic care map on this slide, but it really can help, as you can see on the slide, it can help an individual, a patient, understand their current situation, identify gaps, and plan for potential challenges. So it's really sitting down with someone and saying, you know, who is in your circle. You can see a few circles on this slide. We don't have enough time in today's session to go through like exactly how to draw something, but you'll see on the next slide that there are no real rules. But if someone's saying, oh, I live with so-and-so and so-and-so, but then next door, there's so-and-so, and then all the way on the other side of the country is this other person, and this is how we all take care, you know, I take care of this person takes care of me, we take care of each other, you know, arrows can go in one or both directions. There can be some folks that are far away geographically, but are actually very close as far as a caretaking role. So anyway, it's a really interesting exercise if you ever wanted to do it for yourself personally, just to see kind of like, oh, what is my social network looking like? But when you're doing it with a patient, it may be, depending on the dynamic, that a patient is drawing it themselves or you're helping them. A caregiver might draw something. We can go to the next slide. I think I have a couple other. Again, they're going to be small. Yeah, you can see how it can be done on paper. It can be done on a computer, but actually paper ends up being nicer. You know, even the Atlas of Care folks even suggest they have a digital version, but they actually tell people now to do it on paper because it actually helps you to better understand these connections. So these can change over time. This is you know, we talk about keeping diabetes information up to date, health information up to date. These care maps can change over time, but it's a really great way to talk with an individual patient about what matters to them. So we're not just assuming, oh, well, you live with your husband, so that's of course like going to be the person who's going to help you in an emergency. Maybe, again, maybe it's their next door neighbor, maybe it's someone at the, you know, house of worship down the street, maybe it's someone who's 2 towns over that's going to be the one to help them in an evacuation. So if we don't know that information about a patient, and that patient may be dealing with their own individual barriers in getting prepared for or responding to an emergency, there may be some gaps in care. There may be some ways that we could preemptively get ahead of some of those things, understand who's close to you, who would help you in an emergency, and also get a better sense overall where they may need more assistance. And again, it's putting the patient in the driver's seat. Some patients put their healthcare providers on their map and some don't, which is very interesting, which is again fine. It's not a binding document, it's not something you put in an EHR, but it's someone's understanding of their own social network, which can be such a valuable tool for them for reflection, and then for you as you work with them again and saying, hey, you need assistance. What's going to happen if we have a hurricane? You know, who are you going to call? Who is going to come to your door? So again, it can be used as a starting point in conversation and helpful across the board for their health as well. We can go to the next slide. So I want to wrap this up quickly because I want to ask some questions. We had a very quiet group today. Lots of folks benefit from this. You can use it in or outside of emergency preparedness. So you can see lots of folks that we've talked about through this series. So it's really beneficial. We can go to the next slide. So I won't go through these reflection questions because I do want to hear from the group, but there's more from the Atlas of Caregiving around reflection questions. But thinking about your conversations with patients, thinking about how they may need different types of care, what skills that people bring, especially informal caregivers, bring to the table, who helps with medication or medical assistance, transportation, companionship. Does that change in an emergency? You know, it could be everyday life. Oh yeah, my Nana helps me with this, but is Nana going to be able to help you, you know, when a tornado comes? You know, there's a lot of questions that might need an asterisk when we're thinking about emergency preparedness, but some really good thought-provoking questions. And again, are there things that are missing? Are there professionals or services that are missing that might be able to be a really good visual experience for you and the patient to see where there are gaps? Again, getting ahead of that and providing supportive referrals that will hopefully enable them to have what they need during an emergency. Go to the next slide. So there's an article here, again, from a couple years ago, but diabetes advocates thinking about emergency preparedness, saying, hey, we have some resources, we have some guidance that's helpful. We have a lot that can be done, a lot can be improved upon. And they offered some ideas, thinking about those bigger corporations have a real opportunity to design products with the worst case scenario in mind, really. Again, like charging cables, not as relevant for natural disasters because we don't know if there's going to be a reliable source of electricity. So batteries, are important. Thinking about multiple channels for communication, thinking about programming to educate patients with diabetes. Obviously, there's a lot of diabetes educators in the room, but if there's additional services, trainings for folks living with chronic conditions to be able to know what to do, certainly helpful. And increasing the language options of materials. I know Hansel talked about that last week as well, but really wanting to make sure that we're continuing to improve our efforts to make sure that folks living with chronic conditions have the best materials, the best information that they can to make sure they're adequately protected in emergencies. Is there anything else you would add? I know we've talked about if we're you can see in the title, we're trying to improve this for diabetes management. Is there anything that you would add that would say, you know what, it would be really great if we could be better in XYZ area? Is there anything else that you would add? Jose, I don't want to put you on the spot, but you focus so much on diabetes that I'm curious what you think here. Is there anything else in general that you think can be improved upon?
I mean, what you have presented is very thorough, but just to remind those participating that each patient with diabetes is, different. So in addition to making sure that we address all the social needs and medications and all that stuff that you have mentioned, that we are also dealing with a human being that is completely different. So whenever possible, we have to individualize, the emergency care management for these patients.
Yeah, I think it's so crucial, and it speaks to, there can't just be the one size fits all approach. It has to be that individualized care. So we're close to time, so I want to keep going. We have a question on the next slide that it's going to be more rhetorical. I think we may have asked it in the first session, but thinking about, Chantel, we can go to the next slide. Resources in your area. We can go to the next slide as well, because you'll see I do have a state-based example in the resource list from New Jersey. I think it's a few years old, but it's interesting that they have developed something specifically for patients for diabetes disaster preparedness. There's also some other resources here from the federal level, not only diabetes focused, but a lot of priority patients focused, thinking about technical resources, really rich information in these. So we don't have the time to go through them, but if you are looking for additional emergency preparedness resources, really great to look through. Let's go to the next slide. So this is what I want. I know I think we had a person to drop off. We're in our last few minutes. Thank you, Juliet, for being so thorough and putting the links in the chat. What will you do with the information that you've learned? So I know, again, I'm gonna take the most positive view and say, you all were very quiet today because the information made sense, and hopefully it was, even if you knew some of it, that it was a helpful way to reflect on your future conversations with patients. Would be curious what your plans are from here. So you signed up because this was an interesting topic to you. Many of you are diabetes educators yourselves, so you understand the need for this information sharing? Do you have relationships with patients? What are you going to do going forward, and what support do you need? I know that sometimes when we take in new information, it can take us a while to figure out what our next steps are. But I'm curious if anyone's brave enough to share. And again, it might feel intimidating at first, but it really can be anywhere from a small step to a big step. So whether that's sharing information, reflecting on the materials you share with others, there could be a lot that's just at that personal level for you. So is anyone willing to share? I thank you all for your time and your attendance to the series. Would love to know kind of what's next for you all. Feel free to come off mute or share in the chat. Either what you do with the information. I know there was a lot of different information that was shared through the last few weeks, or what support you might need. Is there a way that we can offer additional resources or talk through anything? What's on your mind in these last few minutes of the session?
Something that you mentioned that I wasn't very aware of, or that I hadn't thought about, is how your circle changes depending on the circumstance. You might be depending on assistance from so and so, but in the case of an emergency, you aren't able to depend on that person. So what are you going to do? So that's something to keep in mind whenever you are setting up those plans, creating the assessment. I hadn't thought about it, so when you mentioned, I thought, wow, you gave me that is a good thing to keep in mind. And also mentioned that something that we were missing on that list, or that you could have added that on that list, would be the usage of a CHW, right?
Yes.
To go out in the community and provide that information. What good is it if we're providing it to them if they're not taking action on it? And the CHW not only does provide the information, but they give that little nudge that the individual might need in order to take some action.
Yeah. I mean, it's so great to have folks in that role. And I know that you had some resources last week, Hansel, around utilizing CHWs in emergency preparedness and response. So if folks want to look back at that, that's really relevant if it's not something that you're doing now. Because not everyone has the time, not every role has the time to work one-on-one with patients, but it's so crucial for effective emergency preparedness. So to have folks in that role is really great. Well, we have a quiet group, and that's okay. If you're here to just have your own quiet reflections, we have just 2 minutes. So I do want to leave time for, of course, evaluation. We're going to go to the next slide. So what we've done every session is launch a very quick poll that's anonymous. We don't share it with the group, but just on today's session, you can give just really quick responses. Juliet can launch the poll. We also have a series evaluation. So I know that gets confusing. I feel like every year I get a little confused. So we would love for you to both respond to the quick poll just about today's session. And then also there's going to be a SurveyMonkey link. It's going to be in the chat box. It's also going to pop up I think when you close out of the Zoom, we're going to email it to you. So we are going to make sure you easily have access to that SurveyMonkey link. It's going to require everyone to just select the learning collaborative they participated in. So you'll see on this slide that ours, again, was improving emergency preparedness for diabetes management. We talked about at the beginning of the session. There's 4 learning collaboratives in total that were put on by our task force. So there's 4 different options on the SurveyMonkey. So you'd be selecting first, improving emergency preparedness for diabetes management, and then every other question is going to be related to just our learning collaborative together. So thank you to those who've responded to the poll. If you still haven't, please do take one moment to fill out the quick Zoom poll and then pop over to the Survey Monkey. Again, it's in the chat. It will pop up hopefully when you exit the Zoom, and we'll email it to you. We'll do some follow-up. We'd love to stay in touch. We appreciate everyone's time. If you're still reflecting on your next steps, we're going to follow up in a few months as well, just to see how things are going. You know, this emergency preparedness is an ongoing process. So if you're encountering questions or concerns along the way, our respective organizations are here to help. Chantel, you can put to the last slide as we're at time. Our email addresses are on the slide, but you can also respond to the emails that you've gotten from Juliet at our center, and she can pass that along to us as well. So again, thank you. I know we're over time. Have a wonderful rest of your day. We hope to see you in future learning opportunities. Take care, everyone. Bye-bye.